So I'm welcoming Michelle Staples, who's a pharmacist working for the Centre for Pharmacy Postgraduate Education. Having worked mainly in community pharmacy, Michelle stepped into education over 8 years ago and is currently an education supervisor supporting CPPE's longer pathways of learning. As a regional tutor, Michelle facilitates online and local face-to-face workshops and networks with stakeholders across the Northwest. Michelle is passionate about environmental issues and currently leads the Greener team at CPPE. And she's going to talk to us about a project where they've looked back at their QI projects they've been supervising and found some sustainability within it. So let me stop sharing and I'm going to hand over to Michelle to reveal all.
Thank you, Ioma. Hopefully I can quickly share my screen. Hopefully everybody can see that and hear me okay. So as Ioma said, I am Michelle Staples, one of the education supervisors and regional tutors at CPP, which is the Centre for Pharmacy Postgraduate Education. And we've been working on a retrospective abstract analysis of PCPEP Learner Quality Improvement Project. I'll give you a little bit of background. So pharmacists and pharmacy technicians in additional roles reimbursement scheme roles working in the primary care networks or the PCNs join an NHS England funded 15 or 18-month programme called the Primary Care Pharmacy Education Pathway, or PCPEP as it's referred to. As part of their leadership module, which lands around months 13 to 15 of their pathway, they undertake a quality improvement project. So this is a compulsory part of the programme, and it's a great opportunity for somebody who's never done a project before to have to do one and learn some of those leadership skills behind quality improvement projects. So there's been probably over 10,000 projects planned or completed as part of one of CPP's longer pathways, including PCPEP. And these have covered a really wide range of clinical and procedural topics. But the overall impact of these has not been measured. So we wanted to analyse why some of this information so we could be shared more widely. And we also wanted to learn what we could do differently as education supervisors to support people with sharing their projects more widely and also to help them with that project process. So as education supervisors, we support the learners by listening to their projects. We read their abstracts as part of the assessment process for their leadership module, and they present to a small group of their peers as well. So we figured that these categories would quite work in looking at the projects overall. So what cohorts or whereabouts in the pathway they were, if they were pharmacists or pharmacy technicians, the title, whether the project was completed or ongoing, medicines optimization, where medicines being added in, where they're being prescribed, where patient safety is involved, where a lot of monitoring and projects, there was a lot of monitoring projects. Was the patient contacted in any way? Did they have a face-to-face or online consultation? Team working, did they include the multidisciplinary team in their projects, or was there any multidisciplinary team learning involved? Waste reduction, cost savings, any data included that we could go back to, any process changes that happened as part of the project, and use of guidelines. We also wanted to look at sustainability within the projects. And on listening and reading the projects as a group of education supervisors, we realised that not many people touched on the sustainability aspect of their projects. But being inspired by coming to this showcase for the last couple of years, I sort of knew that a lot of our projects probably did touch at least one of the 4 principles of sustainable healthcare. Prevention, patient empowerment and self-care, lean processes and lower carbon alternatives. So we looked at 40% of abstracts submitted between 2021 and 2025, That was cohort 5 of PCPEP, which was the first one to include pharmacy technicians, to cohort 14, which was the last cohort to finish before we started the analysis last summer. 14 education supervisors categorised 2,446 project abstracts, with 1,384 projects classified as completed. And we used what was on the Centre of Sustainability Sustainable Healthcare website last summer, and used these 4 principles along with the definitions to help with our categorisation. And this was probably the only part of the categorisation where we as education supervisors made a judgment on whether their project did meet one or more of these particular principles. So out of the 1,384 projects, as you can see, there's quite a lot meant at least one or more of those projects. We had 859 met prevention, 874 met patient empowerment and self-care, 109 met lean processes, which we weren't surprised about because a lot of process improvement was seen through the project, and 70 met lower carbon alternatives. And this didn't stick to just one principle. We found that 568 actually met 3 of the 4 principles we looked at, and 2 principles were also met, with 256 and 30 met with 4 principles. So with the 850 my completed projects included prevention, we had topics like DOAC. So there was a really strong theme, as I've already said, of patient safety and also monitoring, and especially the projects that were done nearer to the end of COVID. A lot of surgeries and PCNs were catching up on that medicine safety related work. So many projects did include that. But we've also got projects on diabetes, lipid prevention, statin safety and optimization, hypertension, and that filled in lots of different things, such as communicating with other parts of the system, hypertension case finding service, and again, atrial fibrillation, heart failure, and asthma and COPD and inhalers really featured heavily. For patient empowerment and self-care, the topics again included inhaler use, but we also had some ADHD shared agreements. And again, this was a really big issue in primary care and continues to be with that shared care agreement, especially from the private services. And again, DOAC monitoring and DMARD monitoring, along with opioid, gabapentin and SED drug optimization. And I think that definitely the opioid and gabapentin deprescribing, a real patient involvement had to be implemented in those projects. I said earlier on that lean processes, we weren't surprised about this. We knew that a lot of those projects did include changes in process. But also we saw a lot of non-clinical topics fall into this category, including electronic repeat dispensing, community pharmacy consultation service, which was the precursor to Pharmacy First, and the discharge medicine service referrals, high-risk drug monitoring, and long-term condition monitoring, and also safety along with valproate and steroid safety. Lower carbon alternatives. This was one that we found most challenging to categorise due to our own unsureness or lack of specific knowledge. Most of them included lower carbon inhaler switches, and we did have a couple of cohorts that many projects were done on lower carbon inhaler switches. Care homes waste, though, was one thing that did pop up in this particular area. GTN waste and also a pilot triage model was one of the topics that I picked out when we were looking at it. My takeaway point is that 86% of the projects included one or more principle of sustainable healthcare. However, only a handful actually considered this in their abstract. And we're, as education supervisors, we're taking this away, looking at what we can do differently to inspire people to think of things through that sustainability lens. So for your next project, no matter what the topic, please look at it via a sustainability lens and share how your work is contributing towards that sustainable healthcare system. Here is a quick nod to my colleagues who were on the research team. And thank you very much. And please contact me if you've got any further questions. This is a massive amount of data that we're wading through at the moment. So thank you for taking the time to listen today.
Thank you, Michelle. So interesting to hear about all the untapped potential in those projects.